Medics concerned about women's health constantly remind them of the need to regularly undergo breast cancer examinations, while men need prostate tests. After the age of 45, there is a substantially greater chance of changes in the prostate gland, which cause changes in life quality, but also the possibility of prostate cancer. Annual PSA analysis is best at protecting against cancer. PSA is nothing other than analysis that involves one check. Don't be afraid. It's nothing scary. Lots of us remember old cliches from the Soviet era or the present day. It's fast, nothing more or less. PSA analyses and timely consultations with a urologist will make it possible to discover malignant changes, as well as to ensure a more successful treatment plan. A positive thing is that in 97% of cases, prostate cancer is treatable. Men wonder what doctors will say when they find out that they have prostate cancer. People need to change their opinion, thinking less about what others will say, but really think more about what will happen if I get sick without testing myself in a timely manner. What will happen to me as a man and to my masculinity? I think that's the key thing, not worrying whether I have it or not. CyberKnife therapy is recognized in the world as the most effective and safest treatment in the case of low or medium-risk cancer cases, least affecting the patient's quality of life. It is used to treat first and second-level prostate tumors.
Pie primārā prostatas audzēja radioķirurģija ASV vadlīnijās ir oficiāli atzīta ārstēšanas metode.
U.S. guidelines officially recognize radiosurgery as a treatment for low-risk tumors and non-malignant medium-risk ones. Throughout the world, it is also used for less favorable middle-risk tumors and even for high-risk ones if the patient categorically rejects surgical treatment. Side effects are much different than with surgical treatment. After radiosurgery, we almost never see problems with urine retention.
Pēc radioķirurģijas praktiski nekad nenovērojam urīna nesaturēšanu pacientiem.
Mūsu metode šeit Siguldā tiek realizēta.
We've used this method here in Sigulda for more than 6 years. That means that we can convincingly speak of results elsewhere in the world, but also our results when using this prostate cancer treatment here. A man who receives it basically lives the same life as before the diagnosis. Very few methods enable the same quality of life as existed before radical treatments.
Kāda ir pirms radikālas ārstēšanas.
The effectiveness of CyberKnife as a treatment is globally recognized, easily tolerable, fast, and painless. I relied on CyberKnife because my health was important to me. When I visited the clinic for CyberKnife procedures, to be honest, it was like visiting a spa. It was important to have no side effects so that I felt well and could keep working. I was diagnosed with third-stage prostate cancer in 2010. Of course, I went to the Riga Oncology Center for hormone therapy. At first, the PSA level dropped, but then it increased again. I had radiation treatment in 2013, after which the same happened. I knew that there was CyberKnife in Sigulda. All of the people are nice. They listened to me during the radiation process. The attitude was excellent. They were interested in the post-radiation situation. That was critical, and I'm alive. That's the main thing. If I hadn't been to Sigulda, we would not be talking. We invite you not to postpone your health checks. Early diagnoses are more easily treated.
Mēs joprojām šo terapiju veicam.
We still use this therapy at a high level of quality and in line with global clinical experience. The results of our work prove that. Second, the process is fast. It's basically the only one to assure that it takes less than 2 weeks between when you come to the clinic and when the process is done. You have to spend 5 days in Sigulda. We can fully cure the cancer during your vacation or medical leave with very good results.
Pilnībā šo vēzi izārstēt un ar ļoti labiem rezultātiem.